got that.
And how we get there is totally different for each individual.
Well, let's just talk a little bit about how old are you now?
77.
77. A lot of dentists have to retire for health reasons. Here you are at 77. You basically work full time, don't you?
I've cut back my hours considerably, but
Okay. And I know at one point you were contemplating retiring or maybe selling your practice or something, and you had some investments that went a direction that you didn't want, and and we were all sorrowful for you, but I think those of us who were patients were kind of excited too, because that meant you were gonna stay in the trenches longer, and we don't want to lose you. What give us some of your secrets. I mean, your mind is sharp. I mean, your hands, when you do dental work with me, your hands are really stable. And
well, I've tried. Well, I don't exercise intensely, but I do exercise. Do some stretching every day. I've done yoga in the past. I haven't done it for the last year because I hurt my knee. I fell down, hurt my knee. Tried to eat sensibly. I don't know. I've been blessed with good health. I've always, well, I have had the usual childhood diseases. I've had problem with skin cancers for whatever's going on in my system. But my father died when he was 55, but he was an alcoholic and smoked. I've never done either one. My mother lived to be 88. My grandmother lived to be 88.
are there things that you've done to reduce your exposure to toxins? I mean, as a dentist, there's a lot of.
I used to get a massage every week. I get acupuncture done periodically, chiropractic treatment sometimes. I've tried to eat sensibly.
Now you have an ozone generator in the other room, correct? Isn't that?
No, that's not. No, that's just a air purifier.
Okay. Are there things that you think you've maybe done differently in dentistry? I've attributed some of the early retirement that a lot of dentists do, one, just due to the mercury exposure over the years. I've read studies where it's a clear connection between Parkinson-like symptoms and chronic mercury exposure in dentistry.
I haven't used mercury in my practice since 1984. I've taken out a lot of mercury. I've always used a full mask to do that, respirator type mask to do that, so that I don't breathe that vapors in when I take it out. What that's contributed to it. I used to get massages every week. I did for years. Tried to eat sensibly, exercise, taking time off.
I have noticed you've actually always done pretty well with that, taking time off. I remember it took me a long time to learn how to do that as a chiropractor, but early on I used to be jealous of dentists. I'm like, they can schedule when they want to be in the office and out of the office. I felt like I had to be there every day for my patients. Well, in the end, I learned that I really didn't have to be. But yeah, you've done pretty good with vacations.
I've tried to do that a lot, especially the last 25, 28 years. Take a couple of weeks off in the wintertime to get out of here if possible. Haven't done that every year, but just taking time off. Even though I'm a workaholic, I've tried to schedule more time away from the office because you have to get away from here periodically. Dentistry was at one time considered the highest disability profession. Had the highest rate of suicide, divorce, heart attack, and disability of any profession. I don't know if it's still that way. I suspect a lot of that has to do with, well, I attribute, in my case, to one of them is nitrous oxide.
Hmm.
If it hadn't been for nitrous, in spite of whatever people say about it, for me, it helped me cope with feeling people's pain and fear.
Yeah.
It made it possible for me to relax more when I was doing dentistry. You know, and some dentists charge for nitrous oxide. I've always said I'd pay people to use it because it made such a difference for me.
Yeah.
Not just them, but for me. And when I first started using it and offering it to people after I had experienced feeling some of the relief that I felt when if they didn't want to use it, I got really uptight. It's like, oh, I don't know if I can work on you or not, because there was such a difference for me. And I think, at least for me, that's made a huge difference in why I've been able to keep working.
Yeah.
Even though I don't use them on every patient, I don't even offer it to all of our patients. We have some that don't want it, and that's fine.
Well, even on a bigger, a more generic topic kind of that this brings up is really creating your practice in a way that sustains and nourishes you.
Exactly.
You know, whether it's nitric oxide, whether it's what color you paint the walls,
Exactly.
or the music you play. Now, I've also noticed, though, that your family has worked here for a lot of years. And I have family involved in my business. I've worked for my dad as a kid, my brother bought my dad's company. So we understand nepotism a little bit. There's some pros and cons there. Sure.
Start off a minute, will you?